Dr. Shruti and I have done my fellowship in aesthetic and restorative dentistry from Savita Dental College.
What exactly are veneers?
So उसमें अलग अलग मटेरियल्स आते हैं लाइक ईमैक्स लिथियम डाइसिलिकेट अगर ठोकना है तो ये 55 मिनट्स मोर देन इनफ
More than enough.
या
Yeah, just cement ऐसे लगाना है तो it's more than enough.
इसमें भी टाइम लगता है डन
Hello everyone, welcome to today's podcast. Over here with us we have Dr. Shruti Dr. who is a well-known aesthetic dentist. Shruti, welcome.
Thank you for having me and thank you for inviting me to the first podcast.
So Shruti, tell us something about yourself.
So, hi, let me just reintroduce myself. I'm Dr. Shruti and I have done my fellowship in aesthetic and restorative dentistry from Savita Dental College. And I have been practicing restorative dentistry for past 3 years, where we focus on the functionality of the tooth, longevity of the tooth, eventually giving you the beautiful outcome that is what you see as your final result.
So, what inspired to specialize in aesthetic dentistry?
Honestly, there was a time where I was crazy about being an oral surgeon.
Mm-hmm.
So that when I appeared for the NEET, I was really disheartened कि यार मेरे को OS की सीट नहीं मिली, मेरे को सब मिल रहा है लेकिन OS नहीं मिल रहा है. Then finally I was like ठीक है, let me just explore my options and see what general dentistry has to offer. And then slowly I got a hang कि oh this is something that I can do. ये अच्छा लग रहा है मुझे. And one thing that always resonated with me was during my internship, I had a mentor who told me, I'm sure तेरा surgical skills अच्छे होंगे, but I would definitely want you to explore the restorative and endodontic angle because your restorative skills are too good and they are still raw, unpolished. So try exploring अगर वो opportunity दो तुम खुद को. So when NEET happened, life happened, OS नहीं मिला, चलो देख लेते हैं. And then slowly when I could see the results, I was like, yeah, कर सकते हैं. I enrolled myself into different hands-on curriculums, finally reaching to a point कि हाँ, अब मुझे 1 year की fellowship करनी है. And that is how I got into the restorative part of the dentistry.
So, where did you get this fellowship done from?
So this is a college in Chennai called Savita Dental College and they offer various fellowship programs, aesthetic and restorative being one of them.
Mm-hmm. So, I would like to ask you a question over here. I remember meeting you somewhere in 2014 or 15 for that, but this is a story from that time.
Okay.
And I could be wrong as well because you know your timelines better than me. So during this time, I remember that you were working at a place and you were asked to complete a composite restoration in, I believe, 15 to 20 minutes.
Oh yes.
How much time does it take now?
It really depends on so many factors, but on an average, it takes roughly around an hour.
Per tooth, that is?
Yes.
So 15 to 20 minutes ऐसा बोलना चाहिए कि
सिर्फ आइसोलेट करने में चला जाता है, बेसिक प्रिपरेशन में जाता है to make the patient comfortable, anesthetize करो, isolate करो. Now your tooth base is ready. अब तुम restore करने जा रहे हो. 15-20 minutes for the entire restoration was not possible. At least it is not possible for me. I don't know who's doing it.
So it would be possible अगर अच्छा नहीं दिखना चाहता है तो, अच्छा लास्ट नहीं करना चाहता है तो.
Yeah, अगर आपको थोपना है तो yes, 55 minutes more than enough.
More than enough.
Yeah.
Yeah, just cement ऐसे लगाना है तो it's more than enough.
इसमें भी टाइम लगता है. Done.
Okay. So Shruti, let's continue with the second part of today's podcast, I would want to understand it from the patient's perspective that what should patients look for when they are choosing an aesthetic dentist?
That is actually a really good question. What usually I have seen is people will more focus on the price aspect of any certain treatment rather than the longevity and quality of the treatment. So I would recommend, of course, price is a big point for anyone. It is a major financial investment, but also it is a major dental investment as well. So I would recommend anyone who's looking for any sort of cosmetic treatments, go to your dentist, have a word with them, and ask them if they can show you any of their real cases and if they have a long term follow up of those cases. So then you know कि आप exactly किस चीज के लिए you are investing, not just financial wise, but your longevity and final outcome of the treatment.
So I see many of these young patients outside. What they do is they are okay in investing in an iPhone.
Yeah,
However, when it comes to investing in health or in dentistry, they feel this is expensive. So,
absolutely.
what is your take on it? Should they invest in iPhone at the same time? Should they also invest in health?
Well, iPhone is something that is a completely personal decision. I would not want to comment on it. But अगर आप health point of view से पूछोगे तो मैं तो यही बोलूँगी कि इतना अगर XYZ if your is the cost of your treatment, it is easily going to last you for a decade. Just divide that cost for a decade and see how much exactly are you investing.
So, for all those patients outside who are still looking for an aesthetic dentist, this is a very good answer. And I believe 10 years तो एक phone भी last नहीं करेगा. In fact, we get bored with the phone after a few years of time and we want to change the phone. So, thank you for this answer. I would want to understand in your 3 years of aesthetic dentist life, have you ever had a patient who had unrealistic expectations from you?
Yeah. Most of them do come with an unrealistic expectation because of Instagram or social media, the dramatic before and after, or the promotions of 1 day smile makeover or 7 day smile makeover. They do come.
So,
But
can
उसमें ऐसा हो जाता है कि okay fine, I can give you a 1 day smile makeover, I can do a 7 day smile makeover, but it all depends on the functionality of the tooth rather than the aesthetic outcome. So honestly, I would not like to call myself as the aesthetic dentist. I would call myself as the restorative one because we are focusing on first at the functionality of your bite, your teeth, and then eventually जो final outcome आ रहा है, that is just, yeah.
So again, this brings into picture a lecture which I had attended a few years back, and when all the dentists were asked, "Ki, what dentist, what MDS have you done in?" People were saying we had done it in endodontics, and people forgot that it's restorative, conservative dentistry and endodontics. So I'm very happy that you brought this into the picture. That conservative is a part of your aesthetic dentistry as well.
Major part of my restorative journey. If I have a tooth that can be restored, I can re-restore it. But if I don't have something that is going to create a good base or foundation for my final restoration, it makes no sense.
I would like to let the audience know about some one patient that you had with an unrealistic expectation and what exactly had happened in that case.
So, few, I think, yeah, year back, I had a consultation call for a re-restoration work.
Mm-hmm.
So after examining, she had canine to canine composite veneers upper and lower, and now she wanted to redo it because the composite veneer was discoloring, and I think it was after 8 years of use. Fairly decent amount of use, I can say. So upon proper examination, she was an ideal case for ceramic crowns or an FMR. She did not have a good molar relation. She had lots of red flags in her occlusion, fractured teeth, amalgam restorations, leaking amalgam restorations. And the patient was really adamant कि नहीं मुझे यही चाहिए. This is what I want. After a lot of counseling, still she was like, no, I am okay to sign any consent that you put forward. but I still want you to restore my teeth with composites. Like, fine. If that is what you want, let me just see what I can do. So we went ahead, we did a digital mock-up for her in order to change the length and shape and give her a well balanced smile. She was not happy with that. She's like, I just want what I have. Don't change anything. Even if my teeth are not showing when I'm smiling, I am okay with it. Like, fine. आपका smile, आपके दांत. If this is aesthetic to you, I am okay with it. Let me just go ahead. As I was reducing and removing the old composite restorations, I could see the substrate had discolored. It was not the composite that was discolored, it was the actual dentinal substrate. And the previous dentist who did the restoration for her had actually done a crown preparation. Oh. And restored it with composites. And this condition was for her all canine to canine, 6 teeth, upper and lowers. We went ahead, we gave, and she wanted a very bright smile. Mm-hmm. The laterals were placed 2 or 3 millimeters into the palate. Centrals were proclined, and she's like, नहीं, यही चाहिए, ऐसा ही करो. Fine, किया. Because the substrate was discolored, the composite eventually, which was meant to give an A1 shade, gave us a A2.5 or 3 shade. We had to restore everything, give her a bleach shade, yet it was a yellow toned tea. So it didn't come to A1 even in that case. No, it was not. Not ready for an internal bleaching, not ready for ceramic. And after I think in the last appointment, I was just having an informal discussion with her. Why do you want to just go ahead with the composites now that we have done it? Mm-hmm. It this is the it's maximum that I can do for you. Why were you so adamant कि नहीं करना है कुछ और? So she's like, my sister-in-law got her zirconia crowns done, and after 15 years, she could see a black demarcation line. So that is why I wanted just composite because it did not give me a black demarcation line. It just happened. 15 years. So, which means the audience, every person is unique, every person is different. There'll be some whose expectations can be met, yeah, and there'll be some whose expectations won't be able to be kept. So, that's one thing that also is to be taken into consideration. I also like to add over here one thing when you speak about your journey and how did you come to become an aesthetic dentist. Uh, I remember meeting you first somewhere around 12 or 13, and you had come to the clinic asking for extracted teeth. Actually, you were a big part of that journey. From shifting my perspective from oral surgery to restorative. Okay, circling back to that, I had visited his clinic in order to ask for some extracted teeth for my preclinical practice. And he mentioned that right now he doesn't have anything, but you can come back after a week or so. Until then, he will collect something and keep it ready for me. I just have to keep a jar. Like, okay, मैं एक हफ्ते बाद जा रही हूँ hostel. So I told my mom that you have to go to this particular clinic in this particular place, and the name is Smiling Teeth. You just have to collect the teeth. My sweet, sweet, sweet mom, she got confused. She roamed the entire area, visited clinic to clinic asking for smiling teeth. And not just that, उसने ये अकेले नहीं किया. She put 3 or 4 relatives in. कोई थाने कल्याण डोंबिवली वाशी में क्लिनिक में जाके स्माइलिंग टीथ मांग रहा है. So were you able to find those smiling teeth? They were just confused. They were like, I don't know what you are asking for. And then later in the evening, she gives me a call. I did not get any smiling teeth. You were supposed to go to smiling teeth. But did she come to my clinic? I don't remember. Did not. Oh God! Oh. And then finally you came back and got yes. those extra. Oh, that's good. But then it was a good thing for me because एक जार की जगह पे 2 जार मिले. That's the helping nature that I always have. I don't want to stop my helping nature, and whenever any colleague comes to me, I'm always ready for help. So let us also explain the audience about a few myths, and let us also help them to understand the truth about aesthetic dentists. So these days, I have seen a lot of serums and teeth whitening strips that are available online, and people are actually buying it and using it to whiten the teeth. Can you throw some light on it? So the serums that I've heard about is the purple serum or purple toothpaste. The basic concept that I understand about these purple serums and the toothpaste is they are basically playing with the theory of relativity. When you apply a purple color on a yellow toned teeth, which are our natural shade of the teeth, it appears white. However, the strips they do actually work for a certain segment of population who are just interested in a mild whitening of their tooth. If you have a really discolored teeth or the entire dentition is quite discolored, then they may or may not be effective. A professional teeth whitening would give you a better result, and all these things at home kits can be used as your maintenance rather than a primary treatment.
So which means अगर आप teeth whitening का देख रहे हैं, so going to a dentist or an aesthetic dentist would be much better or give you a better result as compared to buying those strips. श्रुति, मैंने रिसेंटली और एक ट्रेंड देखा है. आई मीन दीज थिंग्स गो मोर अबाउट on TikTok and Instagram, where young patients, what they do, or young people, what they do is, in order to look good, they go to a dentist and get veneers done or caps done on all the teeth. So, which means they are literally chopping down teeth and they are doing caps and veneers on all the teeth, even when it's not required. What would you tell about this particular trend?
Veneers, fine, because you don't need to shave down a lot. When I'm saying shave, you actually need to remove a 0.5 millimeter of your tooth structure in order to give you a veneer. But when it comes to crown, it is 360-degree circumferential reduction, which is a significant reduction. And all these procedures are irreversible. So once you have gotten it done, Jabi it is going to come to a timeline that now you have used up the life of that particular restoration. You have to repeat everything.
Mm-hmm.
With veneers, because we have a tooth structure, we have a decent amount of tooth structure remaining. I can redo the veneers for you. But with crowns, there have been cases where it has led to catastrophic failure. So once the tooth is out, there is nothing you can do about it. So just be a little aware. इतना ज़्यादा मत करो just for the trend.
Yeah. So audience, this is particularly for you. If you are going to get some treatment done, don't just do it because others are doing it. Don't just go for that trend. Rather do it when it's required. Meet a good dentist or good aesthetic dentist who will advise you what is needed and will do it in the most conservative way for you.
The more tooth structure you save, the better life you have of your teeth.
I've also seen one particular thing over here, Shruti, that particularly in Philippines.
Yeah, I've seen that. They put braces on their teeth because it appears good, or I think it's a status symbol.
I'm not sure exactly because I have myself not been to Philippines or not spoken to them. But yes, to some extent, it is also a status symbol, and every other young person over there goes for braces. So it's everyone wants to do it.
What I have seen on, I think it is IG content. They have put braces, brackets on dentures. They are wearing removable retainers that have braces applied to them.
Mm-hmm.
Or if you are actually affording that entire treatment, they are putting braces on their teeth without a wire.
Without a wire.
They just want it.
So only a bracket is what they are doing, is what she's saying. Yeah, coming to a point, I see 2 brackets on your upper teeth as well. Can you please brief a little about what's going on in your mouth?
Just FYI to clarify, which a lot of people have this misconception. They are actually canine extrusion. I'm getting it done for my functional stability.
So which means, Shruti, you're saying that braces, or to some extent they are also a part of cosmetic treatment.
Yeah.
So you're doing braces not only to look good, but also to stabilize the bite?
Yes. So my primary concern to get the braces done was an unstable bite, and I had nocturnal parafunction, which led to a lot of fractured cusps and bone out canines. And in order to correct that, now we are getting my ortho treatment done. It is not for aesthetics. I was very happy with the way my previous smile looked.
I should say that your previous smile छोड़ो अभी का smile भी अच्छा है. I have always loved your smile that you had over a period of time. It is always good and aesthetic. So Shruti, many patients also ask me कि do veneers damage the natural teeth?
No. It depends on how much do you need to remove or shape a tooth structure for the veneer to stay on the tooth. So there are different options. So अगर आप composite veneer कर रहे हो तो आपको tooth structure को touch करने की जरूरत ही नहीं है. Unless I am restoring a decay or a cavity, then definitely I'll have to reduce or prepare a tooth structure so that now my composite is going to stay. But I would not prep a teeth to give a composite veneer. That will be no prep. Secondly, there are various options of giving a no prep ceramic veneer as well, but then case dependent. And third would be a minimally prepped ceramic veneer where I'm going to only remove 0.5 to 0.8 millimeters of the tooth structure and give you a veneer. So no, it doesn't damage the tooth structure. Your crowns would be more aggressive if you're looking for a smile designing just for a smile designing and आप crowns दे रहे हो. That is more aggressive than a veneer.
So audience आपके लिए ये बहुत ही important चीज़ बताइए कि if you are going to an aesthetic dentist, so veneers will be more conservative as compared to a crown. So veneers आपका tooth, natural tooth को बचाएगा as compared to a crown. पर श्रुति, there are many patients जो मैंने देखे एंड मुझे पूछते हैं कि मैं आधे कैप के लिए पैसा ज़्यादा क्यों भरूं, which means पूरा कैप दो और पैसा कम, आप आधा दे रहे हो एंड पैसा ज़्यादा.
ऐसा मेरे साथ भी हुआ है. A lot of people have this misconception कि जितना ज़्यादा ceramic का structure होगा उतना ज़्यादा strength होगा, but strength जो आती है वो tooth से आती है. Ceramic is definitely going to cover the tooth. It is going to make it stronger. But if your tooth is already weakened, why should I remove a good, strong, healthy teeth structure and give you a cap just because you want to make it look pretty?
So I think ये question hand in hand वैसे जाता है कि अगर आप ऑपरेशन थिएटर पे हो एंड आपको क्या प्रिफरेबल रहेगा, समथिंग विच इज़ मोर कंजर्वेटिव, समथिंग लाइक अ रोबोटिक, या पूरा खोल दो एंड डू लीस्ट कंजर्वेटिव. Right? So people would always prefer more conservative and that helps in the long run.
Yes, it does. Because if there is a damage to my composite veneer or over a period of time, no matter what treatment you go for, it is going to fail. It is because not because the dentist has done something wrong or as the patient you have not maintained it, but everything comes with an expiry date. So let my composite fail after it reaches that its full lifetime. Let my veneer fail. क्योंकि ये failure are still something that I can redo it because आपका दांत बचता है.
Correct.
अगर आपका crown fail हुआ, there is a possibility that it might fracture the neck of your tooth, and now that's a catastrophic failure. If you lose the teeth, it's game over.
Yeah. So which means every treatment that you do is not going to be lifelong. हाँ, काफ़ी years ज़रूर चलेगा, but remember that even life does not last lifelong. So treatments is just to prolong the life of that particular tooth. So conservative approach will help you in the long run because you can redo it or you can do something else if that fits. Shruti, I would also like to understand when patients come, do they have some misconception about the profession that you belong to, about aesthetic dentistry?
They basically don't understand what it means. All they feel is आप दांत को सुंदर ही तो बनाते हो. So you don't treat my underlying problems, just make it look pretty. So for instance, I had a kid with an open bite, 17 or 18-year-old, refused to get the braces done, and this is not my patient. I was working with someone and they had an open bite. They had a canine which was not fully in its position. The child was adamant कि नहीं करना है braces, कुछ नहीं करो आप, you just make it look pretty and I have 1 month. That person extracted a healthy canine
Oh,
and gave an FPD and gave crowns for an 18-year-old.
that's bad.
So now, after 10 or 15 years later, whenever the crowns are due for its replacement,
Mm-hmm.
I can't even imagine what would be the internal damage or the situation that now it has to be a re-restoration case at the age of 28, 30.
And that patient still has a good number of years of
Yes.
life still remaining.
28, 30. Young adult.
Yeah, that's bad. That's bad.
So, yeah, so to conclude, I feel tackling the internal issues first, keeping the function as the main priority, should be everyone's priority or top 1% of the treatment.
So, which means you are saying that aesthetic dentistry does not only beautify the tooth, it also improves the oral health of that particular person?
Yes, absolutely. It does improve the oral health, not just the oral health, but I have seen cases where after getting the braces treatment, the patient was miraculously cured with the neck pain because it improved the posture of the patient. So, function over aesthetics.
So if you are a patient and if you are finding some dentist who can not only beautify your smile but also help you in improving your oral health, I believe this is a fantastic dentist over here who is not only thinking of beautifying your smile but is also helping you in the long run to improve the oral health. And I believe एक डेंटिस्ट जब ये सोचता है कि बस मुझे इससे पैसे नहीं कमाना है, मुझे सिर्फ पेशेंट का जो रिक्वायरमेंट वो नहीं करना है, मुझे उससे ज़्यादा करके help karna hai so that this person lives healthily for a long run. So I believe that's a very good thing that Dr. Shruti is doing.
Thank you. I would like to add that right now I have a patient who's about to undergo ortho to correct her crossbite. Her concern was just a mild diastema, which someone had corrected with a splinted crown, and now again she was experiencing diastema between her centrals. और अभी तो ज्वाइन कर दिया, डायस्टेमा तो नहीं आएगा, अभी सेंट्रल्स और लैटरल्स के बीच में आएगा. So now we are correcting the entire bite because of that one diastema. If I wanted, I could have just done a composite and yeah, you're done, patchwork हो गया.
So Shruti, अगर इसको ही आगे लेके मैं आपको ऐसे बोलूँ कि say if there is a person who comes to you and say this person needs veneers or say this person needs a full mouth rehabilitation and given a chance, if say this person has a deep bite or something that needs to be corrected orthodontically before you move towards veneers or before you move towards a full mouth rehabilitation, in order to make it more conservative, you do a ortho or a aligner before you enter into veneers or full mouth. So do you think this is a good approach of treating teeth?
It is an ideal approach of treating teeth because once you prep the tooth for any sort of restorative procedure, you are done. अगर मुझे prep ही करना है, why not intrude it? If I don't have that valuable tooth structure remaining, why not do an ortho? Get the kind of clearance I want and then proceed. Of course, it is a long, मतलब time investment ज़्यादा होगा, but अगर मेरा दांत बच रहा है, तो why shouldn't I do that?
So which means a 3 months or a 6 months of treatment time increasing, but increasing the life of that particular tooth for say 10 to 15 more years?
Yes.
Beautiful, beautiful.
So I would like to counteract with that question. What if you have a case of an FMR, यहाँ पे the patient has completely treated everything. Now, in order to raise the bite, you will still have to prep a bit, and now if you prep, you're going to land up in the pulp chamber. Would you do intentional endo for all the teeth?
Never. I would never enter into a root canal because I've seen root canals fail more as compared to prosthetics. So I would always want to avoid those root canals wherever possible.
Exactly. Same concept.
Fantastic. Shruti, this question is specifically for our audience. Can you explain the layman over here or the audience which is watching our videos what exactly are veneers?
So veneers are thin shells of ceramic that are used to place on the top surface of your teeth in order to correct color shape, length and width of your teeth. तो उसमें अलग अलग मटेरियल्स आते हैं लाइक ईमैक्स, लिथियम डाइसिलिकेट, फेल्डस्पैथिक, पोर्सलिन एंड देन multiple variations of them. So depending on what are your priorities and how much thickness of the veneer or that shell of a veneer I need, I'm going to pick a suitable material that is going to last long for a really long period of time for you.
Now, when you describe it in this particular way, there is one more question that comes up to me, and I'm sure the audience will also have this question. Is there are two types that I've also heard as well. One is composite,
Yeah.
and one is ceramic.
Okay, so basic difference आता है composite and ceramic veneers में is the material. So composite is the same tooth colored filling that we use to fill a cavity in your teeth. Now, when I layer it in a fashion inside the clinic in the same day, so when you say ki same day smile designing or smile makeover, this is what we are doing. We are using a composite material to add on to the tooth surface and give you a composite veneer. वो layers में आता है. That is going to give you a natural effect. Whereas a ceramic veneer is a lab processed veneer where I'm going to do a certain analysis of your teeth, your face, your smile. मुझे कहाँ पे वो veneer place करना है? Do I have to lengthen the teeth? Do I have to shorten it? What color do we want? Here you can choose the color. For composite veneers, there is a limitation of how much we can do because we are not prepping your teeth. When I say prepping, I mean we are not touching your teeth. It is on the top of your natural teeth. So in maybe whatever period of time you come and tell me, hey doc, it doesn't look good, I want to go back to my original teeth. If I have not touched your teeth, if I have not prepped it, yes, surely we can get you back. But for ceramic, most of the cases that is not possible because we have shaved a significant portion of your teeth in order to make space for this veneer to stay on the top of it.
Having said that, I'm sure अगर कोई patient आपके पास आएगा और composite veneer करवाएगा, nobody would want to come after a few years and say कि भाई अच्छा नहीं लग रहा है, let's go back to our original teeth. I have seen your work and I'm sure if a person comes and gets treatment done from you, he or she would be much better than what they were actually are or were.
Thank you so much for saying that.
And I'm sure you are so ethical that you would also not want to do treatment or composite veneers for somebody who does not require them.
Absolutely not. Because there are certain cases की एक limitation है that for a composite veneer, and the limitation goes in a way if there is some minor spaces where people might feel that ceramic would be out of their budget, I would happily go ahead and do a composite veneer. But if it's something major or drastic correction, not the right choice.
Let's continue the conversation and also talk about something called as Hollywood smiles.
The bleach veneers, I don't think it would look good on Indian skin tone. Those are completely white, in shades of white.
So something, when you say it doesn't look good on Indian skin, can you tell me more about it? Does it not look pleasant? Does it not look good? Exactly what is it?
So Indian skin tone ranges into a beetish, tanned, sometimes not the right word, brown. So when you're going for a white veneer, it looks evidently fake. It can look good on ethnicities like white skin ethnic people or a really dark skin person, but for the Indian skin tone, it looks very off. It looks like white chiclets. I would happily give some sort of warmth or characters to the veneers so that it looks natural, it's blended.
So if you are a patient and you are going for that extreme white appearance, this is a personal opinion that she has given, and yes, a very well said one, that it definitely looks fake. So please, if you are going for something, don't go for something which looks fake. Go for something which looks more natural and aesthetic in your
We
mouth.
can definitely take you to a lighter shade, but bleach veneers not for Indian population.
Shruti, I would also like to ask you over here something which will help both the patients as well and the dentist as well. uh, what is the difference between you looting something or bonding something?
So the basic difference between looting and bonding comes at the substrate of the prosthesis, which is your crown, veneer, जो भी है. जब मुझे क्राउन फिक्स करना है, इफ आई हैव अ मैकेनिकल रिटेंशन, आई एम गोइंग टू लूट इट. तो अभी जो बॉन्ड बनेगा वो सीमेंट का बॉन्ड बनेगा टूथ के साथ.
So Shruti, I would like to ask you over here, is there a memorable case के भाई wow ये केस एकदम जबरदस्त हो गया है मेरे लिए, and not only you, the patient, everyone was so happy after the case कि भाई मजा आ गया.
Multiple. One case that I precisely remember, he was a 24-year-old boy with a skeletal problem. For 3 years, he was under ortho. He had gotten orthognathic surgery. So, orthognathic surgeries are for people जिनका skeletal में problem है. So, just braces से it is not going to help them. They had to reposition the jaw in order to get to a proper alignment. And after everything, we had finally restored their smile with veneers. And my god, the mind-blowing transformation. Microdontia to a normal tooth shape and size. Microdontia is again when you genetically have a baby sized tooth and उसके ऊपर हम लोग ने minimal prep veneers दिए हुए हैं. Lasting very good. Now he looks beautiful. Then this is a 55-year-old lady. Because of multiple oral health issues, she had to undergo root canals for multiple teeth, and there was barely any tooth structure left. So crowns के साथ में we had given her a smile makeover.
So wow, I believe you are not only just changing the smiles of people, you are transforming lives of people, Shruti.
Entire facial appearance change. So in the before pictures, she was looking tired, less energetic, or a dull appearance on her face. But the moment we placed the crowns, the entire aura of the lady changed.
Super. So this is something amazing. Tooth doesn't only help you in looking good, it will help you to build confidence, and it will actually transform the lives of you if you're looking for getting a cosmetic treatment. Shruti, when we spoke about a memorable case that you said, I would also want to ask you over here is, has it ever happened with you that you have rejected a case?
This was during 6 or 7 months. This was 7 or 8 months back. So this model, aspiring model, she walked in, she wanted a smile makeover, but she had a lot of terms and conditions that I don't want this, I don't want that, I don't want something to be done to my teeth permanently, no alterations to the gum, but I want a certain celebrity like smile, where she was under assumption that all she had gotten was a little bit of tooth lengthening with composites. I tried to explain her that that is not what she has done. This is a celebrity proper smile makeover with alterations in her gums, veneers on her teeth, change of the alignment, some fillers, some botox somewhere in order to get that, achieve that smile. And after a lot of conversations, counselings, we decided that it is best not to treat the patient. So those were completely unrealistic expectations from a procedure that will not fulfill her aesthetic outcomes and eventually lead to disappointment and a negative relation between me and the patient. So we decided it is not the right approach to go ahead with it.
So wow, again, this is one more factor wherein I had asked you in the beginning is, how do you find an aesthetic dentist? I mean, in today's world, there are so many people outside who would accept each and every case in order to just get the money out of it. I believe this is something very unique, which you told to me, that you have rejected some cases as well, not only to minimize the expectations that that person had, but also to bring that person to reality.
So nowadays, the changes that I have done in my practice is I have created a smile assessment form. It's a self smile assessment form where we give the form to the patient and leave them alone in the room. whatever is bothering to the patient, they are expected to tick and write it in detail, so that now when I am counseling the patient or having a conversation with the patient regarding their future smile makeovers, I know what are the priorities. So when I look at you, I can see multiple issues, but are those issues important to you? What is your priority? I can say you need teeth lengthening, but you just want a whitening. Fine, we can go ahead with that.
So which means what Shruti is saying over here is there could be a person जिसके दो दांत के बीच में gap है, and there are some people who are absolutely okay with it,
Yes.
and then they come to an aesthetic dentist just to beautify the smile, just to whiten the smile. So if you are okay with that thing, if you will feel that's completely normal, she says that's perfectly all right, and I'll just whiten.
Wanted to maintain the space between the two teeth because he feels that it is lucky for him. Why not? Okay, your teeth, your smile, if that feels beautiful to you, you are confident with that, please. I am happy to maintain the features. That is also incorporated in the smile assessment form, that what are the features that you love about your smile, not just what you would like to change.
So Shruti over here reminds me of that proverb that beauty lies in the eyes of the beholder. So for that particular person, a space between two teeth was completely normal, and he or she had accepted that as a part of his life. Luck का मुझे पता नहीं है अगर उससे आता है कि नहीं, but yes, beauty lies in the eyes of the beholder, and for that person, that was beautiful and aesthetic. Shruti, let's move to the next segment wherein I would want to understand something about digital smile dentistry. So, can you please put some?
So, digital smile dentistry, I'm going to explain it in a very non technical term, is where I'm going to click pictures of your smile, your face, in attach it or upload it to a software, and with the feedback that you have given me, I'm going to make the necessary changes and deliver you something that before, at this stage, you can accept or reject the treatment, because we are not touching your natural teeth. It is like a prototype. This is how your final smile is going to look. What are the changes that you want me to make? What are the changes that you like, or what are the things that you like? What are the things that you don't like? And आगे हम इसके साथ में क्या कर सकते हैं? At any stage, if you don't like something, you can stop the treatment, you can reject it. नहीं करना है क्योंकि आपके दांत को हम लोग ने हाथ नहीं लगाया है. This can be done on the software. This can be done in your mouth as well. So you get a real time feel how you are going to look after you have gotten a certain treatment done, which is a really good tool for patient motivation. ये कुछ लोग बोलते हैं मुझे नहीं समझ में आ रहा है कि मेरे स्पेसेस बंद हो जाने के बाद में मैं कैसे दिखूंगा, दांत बहुत बड़े लगेंगे क्या, लंबे लगेंगे क्या. So this is we give you the feel कि this is how you're going to look. Are you happy with it? Do you want me to make any changes? And we can do it.
So, Shruti, are you saying this is a reversible procedure?
Yes, it is a reversible procedure because we are not touching your teeth. It is just something. Have you heard of something called a snap-on smiles? और लाइक हम लोग ट्रायल रूम में जाके कपड़े चेंज करके देखते हैं कि ये कैसा दिखने वाला है. इट इज एग्जैक्टली दैट वे. मैं सिर्फ आपको एक स्माइल का ट्रायल दे रही हूँ, आपको नहीं पसंद है, जस्ट पुल इट आउट एंड यू आर डन.
दिस इज लाइक अ टेस्ट ड्राइव. अगर आप कहीं पर जा रहे हैं एंड ट्रीटमेंट करवा रहे हैं, या आप कोई कॉस्ट्यूम खरीद रहे हैं, या आप कोई ब्लेजर या पार्टी वेयर बाय कर रहे हैं, यू आर एक्चुअली बाइंग वेयरिंग इट टू टेस्ट इट कि वो कैसा दिख रहा है. या आप एक कार खरीद रहे हैं, आप एक बाइक खरीद रहे हैं, आप उसको टेस्ट कर रहे हैं इवन बिफोर बाइंग इट, जस्ट टू अंडरस्टैंड द फील ऑफ इट. So Shruti is saying that she does test drives wherein a patient understands or a person understands कि ये मुझ पे कैसे दिखेगा, and this is a completely reversible procedure where you can make changes after it. Tell the patient, tell the dentist कि भाई ये अच्छा दिख रहा है, ये अच्छा नहीं दिख रहा है, and if you are saying कि नहीं भाई मुझे आगे continue नहीं करना है, this is a reversible procedure, you will come back to your original.
Within 5 minutes, you are going to come back to the original teeth. All I have to do is remove the trial drive that I have given you from your teeth. That's it.
Shruti, how do you see cosmetic dentistry evolving in the next 10 years?
As we are speaking, I think there is some new innovation happening somewhere around the world. So next 10 years, so even I'm curious कि क्या होने वाला है. The latest invention that I can think of is the space scanners. तो basically जब हम digital smile designing करते हैं, I need a lot of pictures in various different angles, different positions. A face scanner में all I have to do is tell the patient कि यहाँ पे देखो and ask them to repeat all the movements, and within few seconds or minutes we are done. We have recorded everything. It is going to give me a blueprint of the patient's face, teeth, alignment, scan, smile, and how he is going to look, he or she is going to look. Fantastic.
I
What
think
else do I need?
I think with the recent trend मुझे भी ऐसा लगता है कि नेक्स्ट 10 years क्या 2-3 साल में इतना कुछ आ जाएगा कि आप एक बस वीडियो फीड इन कर दो एंड वो पूरे डिजिटल आउटपुट दे देगा. इनफैक्ट आपको ये भी बता देगा कि इस पे विनियर करना है, इस पे ऑर्थोडोंटिक करेक्शन करना है.
That is what the digital smile designing is doing for us.
Correct.
It
So
is not just planning the smile, it is planning the entire treatment. What else do we need?
Shruti, let's come to the last part of this podcast, the rapid fire round.
I'm excited.
So let's continue with the questions. Rubber dam, non-rubber dam.
Of course, rubber dam.
Composite Emax.
Case dependent.
क्यों भाई बताओ यार, एक चीज चूज करना है आपको. हाँ, इधर तो ऐसे हो गया कि भाई डिप्लोमेटिक आंसर नहीं चलता, रैपिड फायर पॉइंट पे चाहिए मुझको. एंडो नॉन एंडो,
Non-endo.
एस्थेटिक और ओरल सर्जरी.
Aesthetics.
जन्मेश सॉरी.
You'll be very happy.
उसको उसका डिपार्टमेंट, तेरा डिपार्टमेंट.
Exactly.
परफेक्ट. नाइस डाइवर्सिफिकेशन. क्राउन्स, नो क्राउन्स आफ्टर एंडो.
No crowns out there.
Looting, bonding. Visit dentist only if pain, biannual checkups.
What do you think? My annual checkups.
Veneers, crowns,
Yes.
digital, yeah, analog.
Digital.
Check out this space for more podcasts. And if you have a question in mind, if you're a dentist and have a question, if you are the audience, a layman, and you want to ask questions, please drop your questions in the comment box below. And if you have a suggestion, please let us know. If you want some speaker whom you want us to get over here, please let us know, and we'll make sure that we try to accomplish it.